Childbirth in Kenya is an event that most Kenyan women look forward to. Loved ones and family members can hardly wait for the arrival of the little bundle of joy. However, for some, the event is followed by a never-ending nightmare. Many women in rural areas cannot access quality healthcare during their labor period.
I am Weston Hisa. I am a consultant obstetrician, gynecologist, and fistula surgeon working at the Kenyatta National Hospital. And I repair women who have gotten damage of their bladders and urethra during childbirth, the so-called vesico-vaginal fistula. This is a common thing or condition in our setup. Majority of our patients, actually over 90% of our patients, suffer childbirth injuries because one, they are not able to access free medical care as fast as they need it when they are in labor, and for various reasons, sometimes our facilities are so far away that they can't access it.
In some cases, there is obstructed labor, putting both mother and baby at risk, and sometimes one or both die.
The woman gets damaged when the baby cannot negotiate through her vagina to come out to successfully. More often, the babies also die, and sometimes even the mothers die.
The lucky ones escape with a condition that takes away their social standing. Having given birth at 12 years, Carol knows this only too well.
Mi shida nilianza nikiwa na miaka 12, ilikuwa 2 or 3. Sikuwa ninaelewa ni nini inaendelea. Nilikuwa najipata tu makojo inatoka kila wakati, siwezi sema nataka kukojoa ama siwezi sikia. Sasa ilikuwa inatoka tu peke yake. Watu vile walipata ni hivyo, walishindwa ni nini inaendelea. Wakasema hiyo ni kulaaniwa, wakasema maybe nilikosea mtu, niende niombe msamaha. Nikashindwa sasa nitaanzia wapi. Kila mtu akajitenga. Sasa nilikuwa tu na shosho wangu peke yake na hana uwezo wote. Sasa hata pesa kwa nayo yenye ningeweza kwenda nao hospitali.
Fistula has been described by the World Health Organization as the single most dramatic aftermath of neglected childbirth, which is a rampant problem in rural Kenya. It is estimated that only 44% of Kenyan women deliver under a skilled health worker. Globally, 100,000 new obstetric fistula cases result from childbirth each year. More than 2 million women live with fistula worldwide. Most women with fistula suffer in silence. It took Carol a long time to find help.
Nilikaa tu mpaka hiyo 5 years nikakaa. Nilipofika 2007 ndio nikaenda Nairobi. Nikakuja huku Nairobi kukaa na mama mwingine hapa, alikuwa amesema nikuje nimsaidie kuangalia mtoto.
They come to us as a very miserable patients because one, they don't know what is a fistula. And it is very hard to say you are suffering from passing urine or stool. It's a very difficult situation to tell anybody. Some they don't share with anybody. We have been repairing patients living with fistula for almost 30 years. They develop fistula when they are young girls, and yet we repair them when they are 72 years old.
Most relatives of fistula victims do not know what to do in such cases. Peter's wife, Isabel, got fistula after delivering her second child, now 1 month old.
Majina yangu naitwa Peter Mwema, nimeoa, niko na bibi moja. Alipatwa na shida ya fistula, alafu kwa hiyo muda nilishindwa sasa nitaweza fanya nini. Wakati nilisikia amepatikana na hiyo shida, niliona ni kama mwisho wetu umefika. Sasa kulingana na vile majirani walisikia ati amekuwa na hiyo shida, waliona ni kama tuliona ni kama wanatutenga. Kwa sababu hawajaisikia shida kama hiyo kama mahali tunaishi.
Nilipata mimba na nikaenda hospitali kuzaa. Wakaniambia niko na pipi. Sasa vile walinipima kwenda kuzaa mtoto, next day kulala nikaanza kutoka na mkojo. Nimekaa tu kwa nyumba the whole month nikiwa tu nimejihurumia. Juu ukitaka kutembea unaona hauko comfortable, unaona kama kuna kitu ambayo inatendeka.
For teenagers like Ida and Janet, the first delivery was quite unpleasant.
Nilikuwa na mimba, alafu nikaenda hosi nikazaa, nikakaa wiki moja ndio nikagundua niko na hii ugonjwa.
Nilikuwa na shida baada ya kujifungua. Nilijifungua last year, ilikuwa 2012. Venye nilijifungua nikawa na shida ya kwenda choo. Nilikuwa nikienda choo kama ni ngumi itatoka po, lakini kama ni nyepesi yenyewe itaanza kutoka.
These women have recently undergone repair at Kenyatta National Hospital's Clinic 66. Kenyatta National Hospital has the largest VVF repair center in Kenya. This has been made possible by the Flying Doctors Society of Africa. Since its inception, the society has donated the equivalent of 1 billion shillings to the spread of medical outreach in Africa.
I am Dr. Eunice Muringo Kirine. I am the chairperson of the Flying Doctors Society. The reason why I joined the society, which is I'm talking about 30 years ago, was I was very attracted by the work which was being done by this organization.
One of the founders, Sir Michael Wood, had come to Kenya and realized the need to take specialist services to hard-to-reach areas within East Africa. So he learned how to fly, and once he learned how to fly, he became a flying doctor, and that's where the Flying Doctors was born. And in 1971, he decided to create an avenue through which people could contribute as friends and as individuals across the world, and corporates could contribute to the work of the Flying Doctors by donating a small sum every year. So he started a membership organization with a lady called Maddie DeMott, who was an American lady, very passionate philanthropist who had come to East Africa and then felt very passionate about the work of Flying Doctors. So she's the one who carried the Flying Doctors all through the 70s and the 80s, trying to make sure Michael Wood could actually do his work. Dr. Michael Wood also worked with Dr. Anspory, who was also a flying doctor. We used to call her Mama Daktari. And so they were really the engines behind the organization. And from that, the Flying Doctors Society always felt that it was making sure that these doctors could be able to carry out their work.
When somebody talks about the women health or health of women, it's not very attractive. And we felt, at least the Flying Doctors Society of Africa felt that other places were too crowded, yet we had this real and threatening condition, which for many years has been covered, has been sat on, both by the Ministry of Health, which should know better, and indeed by the global world, so to speak. So we decided that we would like to pay more attention to the Fistula program. And the way we started it was very interesting. We started by educating through the radio, informing people about this condition. And within a very short time, we realized that it was not just one place where fistula exists, the problem exists. It's actually across the whole country.
Our core business really as the society, we've got a specific mandate here, is to really spread health care, expert health care to the neediest of the community, primarily in Kenya, but also in the region. We do have programs, for example, in Tanzania and also Uganda. And the way we do that is we really take doctors, expert doctors, professionals, to the very remote parts of this country. We fly them there, we leave them there for 2 or 3 days, They do their specialties in any given remote area that hasn't got those specialists. And then we bring them back here, and we either have our own doctors here, or we actually work in coordination with hospitals like Kenyatta National Hospital, where they also lend us our specialists from there. Another aspect of our work here is what we call charity evacuations. If we find, for example, we get a call from Mandera or Samburu or any of those remote places that haven't got specialized services, we get a call that maybe a lady has got complicated pregnancy or delivery problem. We do send an aircraft to evacuate that particular lady to the nearest facility, most likely to Nairobi here, so that she can actually be given that specialized attention. We do have a membership arrangement whereby we in fact invite people to be members of the society. We're a society, and people become members of the society, and it's on 1,500 shillings a year where you can then become a member. Now, through that membership, we guarantee you, in fact, some medical evacuations. And we've got different categories. We have got the individual categories, whereby you as a Kenyan or any other, you can become a member. We have also membership for corporates. If an organization has staff that maybe do lots of work out there, we do have that corporate membership. We also have got membership for families, so that you can come as a group. We also have membership for tourists who come here, for example, for 2 weeks. They can take a membership for 2 weeks. And with that one, when they're here and they're out there with their safari, whatever it is, and anything happens to them, then we get called in and we evacuate them to Nairobi. And in fact, we can even do arrangements that we can evacuate them to their home base or whatever it is.
Recently, the Rotary Club of Essendon, Australia, presented a cheque of 11 million Kenya shillings at a ceremony held at KNH on 19 September 2013. KNH, as the largest VVF repair centre, received 3 million Kenya shillings of that amount, which will go a long way in carrying out fistula repairs, training medical personnel, and building capacity on the ground to deal with future cases of fistula. Kenyatta National Hospital receives 400 VVF-related cases each year, close to half of the 1,000 VVF cases reported nationally in Kenya.
My name's Mrs. Aris Karanja. I work in Kenyatta National Hospital, Daycare Center. These are 2 theatres stationed at Clinic 66 in reproductive health, which is a specialized unit. I'm a nursing officer. In these 2 theatres, we take care of patients who have got rectovaginal fistula, and these patients, they come to us as they are prepared for theatre. And when they come, they cannot be able to pay or to afford the fee. So at this juncture, we are very, very pleased because we have the flying doctors who have really come to give service or to support most of the clients who cannot be able to support themselves, and also to support others who are in the group. We are happy because we see after that the outcome, the clients are happy, and also even the staff, they become motivated. You see the results of the operations together with the other supportive staff and the other doctors within the department.
My name is Connie Maina, and 2 years ago I relocated to Australia, Melbourne, and I've been a fundraiser and a communicator. That's the career that I've been doing for the past, number of years. And for me, the beauty of seeing a woman dignity, a woman feeling that I can actually face the world once again, because I can imagine you get a child, you've got all the dreams in the world of having a beautiful child, but then it turns back to you, that actually become an outcast because of a sickness that you don't have even money to repair, to kind of go to hospital. A fistula costs about $350, one person. And that's very little money if you look at it. But how many Kenyans will afford 350, especially if they're coming to such remote areas to get them repaired of fistula. And once a woman gets that repair, I can see the difference because I saw it when I was here. I've seen it even today when I visited the hospital and saw the women who have been repaired. They completely look as new people. And some women have lived with this for years. I remember one woman that was repaired, she had this for over 30 years. So you can imagine being chased away from home, being called an outcast, leaking for 30 years. Your husband will never come across you, near you. You'll never have more children. It is devastating. And for me, is that restoring of human dignity and getting a woman to be a woman. That's what gave me that motivation to go out there and say, I'm not going to live in a comfort zone. I'm going to work hard and make sure that we get funds to support women back at home.
We'd like to share our vision with any prospective donor because, as I've already said, we have already some people who are working with us. I've just told you, for example, this Rotary Club of Essendon in Australia. And because of the noble nature of this particular cause, they were able to raise that. Now we want to use, for example, that club in Australia to even spread the word further. Here in Kenya, as I was saying, we are working with, for example, the banks I've mentioned, Consolidated Bank. They are very good sponsors for us. We've got Citibank, which is an American bank, very good sponsors for our programs. The same thing with the Organization of Women in Trade and so many others through, in fact, our corporate members and so on. They do now want to partner with us in this work.
Every year, about 400 women undergo fistula repair, partly due to the efforts of the society. For Isabel and these women, life will never be the same again. Their heads bowed in shame have been lifted up, nightmares now replaced with dreams. All they see is a bright future.
Naweza furahia sana kuendelea na masomo na nikuwe somewhere in the future.
Sasa naona mambo itakuwa mzuri sababu amerekebishwa na madaktari wa flying doctors kutoka Kenyatta huku Kenyatta.
Mi after surgery vile nilitolewa nilisikia vizuri, hata nikienda nyumbani niko sure nitapona na nitarudi kwa kazi zangu za kawaida, sitasumbuliwa na mkojo tena. Juu nilikuwa ashamed, nikienda mahali sasa nitafanyaje, hata kanisa nitaenda aje, hata kazi nitaenda aje, lakini saa hii nimepona na naendelea muendelee na hiyo roho, watu wazidi kukuja juu kuna matibabu, kuna uponyaji. Madaktari na wapongeza na waambia asante sana kwa kazi yao mzuri, waendelee na hiyo roho na watu wakuje zaidi, kuna uponyaji. Madaktari wanafanya kazi na Mungu anaponya.
Get involved in the process of reclaiming women's dignity by donating funds towards the work that Flying Doctors Society of Africa is doing. With only $350, you can change a woman's life forever. Get involved today.